Hello everyone, I'm Charlotte Kilpatrick, reporting for Vaccine Nation from the World Vaccine Congress in Washington. Today I'm delighted that we're joined by Dr. Jerry Brown of Absolute Healthcare Center. It's a privilege to have you here today. Thank you.
Thank you, Charlotte. It's a pleasure being here as well.
Thank you. So to start, would you kindly introduce yourself and your current work?
Okay, thank you. First of all, it's an honor being here. I'm Dr. Jerry F. Brown, a physician from Liberia in West Africa, where I've been serving as the Chief Executive Officer for the primary teaching and referral hospital up until January this year. And currently, I serve as a surgeon, a consulting surgeon at a private facility called the Absolute Healthcare Center. And in the past, I did work with a lot of folks in Liberia in combating the Ebola epidemic, as well as working with the other team in helping to combat the Liberia.
Fantastic, thank you for that introduction. So you joined us for a panel on Ebola and some other infectious diseases. What were some of the key topics or discussion points that came up in this panel?
Thank you. During our discussion, one of the key themes that was brought up has to do with the vaccine availability, especially for Ebola. How feasible is it going to be when, if we had an outbreak today in country, in terms of the availability of the vaccine and the amount we may need, what the cost is going to be like to get it over in the country, was one of the issues that came up. And our capacity to have a repository for vaccine in country was another issue that came out as well. So that if we thought on having vaccine in country, where would it be kept stored? Those are issues. Do we have policies relating to administration of the vaccine and others? And another key issue that came out was how prepared are we as a country and people in terms of our diagnostic capacity, given the fact that we had COVID, Ebola about 10 years ago. Then in 2020, we had COVID-19. How well have we built our diagnostic capacity compared to our neighboring countries? Something I'm of the opinion we are still behind compared to and our two neighbors, Sierra Leone and Guinea. I think if you look at statistics now, we still at the level of having only a level 2 BSL laboratory. But if you went to Sierra Leone and Guinea, they'll have level 3, and not even one, but more than one. Whereas we still have just one level 2 laboratory. So I mean, diagnostic-wise, we still have a long way to go in Liberia. Okay, in terms of preparedness, I think we have a very good preparedness plan in terms of how to respond robustly if there was an outbreak now. We have a very good, robust surveillance plan in place where on a daily basis, information are gathered from the field and thereby submitted to the ministry and onward transmission to WHO for immediate response. So I think that's one area where we have a very good strength in terms of surveillance. Okay, but I think we still need to improve our diagnostic capacity. Okay.
Thank you very much for that overview of the key themes. So you played a critical role in the Ebola response in your country and have been recognized internationally for that.
Yeah.
What are some of the key sort of lessons or experiences that you had during that time that you're hoping to take forward to improve public health or responses in the future?
Okay, thank you. I think one of the strengths we had, which we did carry over to our intervention for COVID, was having a multi-sectorial collaboration where we had partners, both private and public, interacting and bringing on board their strength and making decisions on the way forward. That was one strength we had. The other thing is having a good community engagement where we're able to engage the people to kind of ensure that they don't resist basic public health standard operating procedure that were handed down to them so that the community become receptive. And we also engaged the community health worker who were very helpful in community engagement and contact tracing and that enabled us to be able to identify individual with disease condition that will not come up immediately. And I think that was a significant factor that helped us in combating even COVID. But initially, for Ebola, those things were not in place. Okay, so we did learn a lot from what we went through during Ebola, and that helped us greatly during the time of our intervention with COVID-19. Hence, the situation was not as deadly and or dangerous as we have with Ebola. So I think there are a lot of lessons that we've learned over the past year. We may not be fully capacitated to do all that is done in the West, okay, compared to what we have. Let's say, for example, during the COVID-19 outbreak, it took a longer time before we got ventilators and other things coming in. Later, we managed to get some, but thanks to the clinicians who were the major frontliner, used their clinical skills and knowledge and were able to take care of severe disease conditions and save many lives in the absence of having ventilators around. So, and the other good thing I think we also learned to do is working together as a team. And that played a significant role in helping us make progress in our fight against the pandemic.
Fantastic, thank you so much. You've mentioned the differences in the capacity to respond to COVID-19 between your country and some other countries. Mm-hmm. So could you perhaps identify for some of our readers and watchers some of the key challenges that specifically your country or your region face to getting access to these medical interventions? Why are there these discrepancies in access?
Well, when there are discrepancies in access, you've been comparing our region with those of the West, or well, I don't know when I say the production of, for example, the production of the COVID-19 vaccine and others are something we don't have control over. And so the manufacturer and the producer, as well as the funding, decide where it goes. And I don't think our government has control over such factors. Okay, but we did obtain vaccine, but it was lately. Maybe because we are a smaller nation, I would say, I really don't. But I think it's the political will also that play a significant role in getting some of these things directed to where people wanted to go. I don't think our country was resistant to having vaccines and other things coming in. We were very receptive to it, but it took some time before it came in. And so, but we are grateful that, we even got vaccine before other nations around us. So be as it may, we were still blessed among other nations. Okay? When it comes to diagnostic capacity for us to still be lagging behind compared to other nations, I really trying to figure out why. Because some of the institutions that have helped other institutions around us do exist in Liberia. For example, one of the ESL3 laboratory in one of our neighboring country is being sponsored by the U.S. Army as well as CDC. But ours is mainly having support, but it's not directly by them. I think the Chinese are also helping there as well, but there is none of such kind in Liberia. So I want to begin to wonder why. Again, it may be the political interaction between the countries and institutions that may be influencing this as well, or the decision makers may be uh, playing a key role when it comes to getting those things delivered. Be as it may, I think we still have a long way to go to be able to appropriately combat another epidemic if we had now. Because even cut across human resource capacity, I must say thanks to others who have provided scholarship to a few Liberians who have gone for study in infectious disease. But in terms of quality and quantity, human resource capacity wise, we're still lacking. We think there need to have many persons going further. Thanks for individuals that have been through in different research capacity, especially a group in Liberia referred to as Prevail, working together with NIH. Really been working hard together with the University of Liberia, working hard to build up our research capacity, human resource capacity in research. And that is still ongoing. It's something we must say thanks to them for and hail them for that good gesture. But there is still a big gap that we still need to fill.
Absolutely, and we've spoken to some of your colleagues in the space from Africa CDC who've emphasised the importance of workforce development on the continent. So it's interesting to hear you echo this importance.
Yeah.
My final question is about your time here. We're enormously privileged to have spoken to you, to have heard from you today. Could you tell us what you came here hoping to achieve, or what you've enjoyed most about your time with us?
Well, I thought on first of all when I was asked to come, the topic, we've gone 10 years since Ebola, and what are some of the lessons learned? Are we prepared for another epidemic if it may happen now? Was something that was thought-provoking for me, and I thought it wise to let me go and share my ideas with others. So I was happy to have been part of the panel. I don't think for our setting we are fully prepared. Okay, and one thing I try stressing is that there is no equilibrium when it comes to the distribution of needed supplies in vaccine. Okay, and let's face the fact. I mean, when those things are distributed or available, third world countries don't tend to get a big chunk of it first. It's distributed to the well-developed nation before coming to the developing nation. And so I think that's one thing we need to strive to do and see how we can have an equitable distribution of those resources when the need arises. There were issues brought up during some of the sections I visited has to do with malaria. And I was happy that there's significant discussion being held concerning malaria vaccine. And I hope Liberia may be considered in the not too distant future, given malaria being the number one cause of morbidity in Liberia. And so I see most of the research being directed to East Africa and other places. We hope West Africa will be taken into consideration, where the vaccine, which will not in the not too distant future, malaria vaccine will be a consideration for Liberia and other West African nations. And another thing that captivated my attention is the quest and zeal I see many persons having for research, still striving to come up with new interventions and new ideas. Okay, that was captivating, and it's like, wow, we're sitting there and people they're thinking every day, thinking of how they can impact change, okay, to ensure that we live in a healthy world, okay, and I think that was something that was really thought-provoking, and there were areas where people talk about reduction in funding that, how do you call it, other wealthy nations are not willing to provide funding now to support research and other things. And my response to one of them was, it should be obvious. Obvious in the sense that people pay attention to major crises that we have globally. So if, for example, the war in Gaza continue to persist, the Ukraine-Russian war continue to persist, you had a major pandemic coming out now, you pay less attention to it because of those global crises. So when there are global instability in other parts of the world, it's going to affect any outbreak that we have anywhere in the world. And so I think that's a key issue we need to begin to pay attention to, because if we have instability around the world and there's an outbreak somewhere, we won't pay more attention. I'm sure you can bear with me. The moment the Ukraine and Russian war started, the issue of COVID became nothing. People begin to pay less attention to COVID. Was COVID no longer existing? That's not true. COVID still existed. So these events tend to also will also have impact on our future thought and goal about future pandemic and epidemic response.
Thank you so much for that. I hope that you had a successful time here, and it's been a privilege to speak to you. Thank you for your time.